A 74 years old male admitted in emergency department with a fall. He is known to have rheumatoid arthritis and is on methotrexate and paracetamol. He lives alone in a bungalow and enjoys playing golf. That means he is totally healthy. Though he is 74 years old, but he is totally healthy. And he is independent with all his day-to-day life activity. He complains of left groin pain and therefore has a hip x-ray which confirm displaced intracapsular fracture. What is the best course of the action? Here are the options. Options are cemented hemiarthroplasty, uncemented hemiarthroplasty, total hip replacement, dynamic hip screw, and intramedullary nail. So now we have to find out the best treatment way. That 74 years old male, but he is physically fit, he can do his regular daily day-to-day activity, but he developed displaced intracapsular fracture. What is the management option? So first of all, let's say this is the knee joint, and in this knee joint this portion is the intracapsular portion of the femur, and just below the capsule there is extracapsular portion of the hip joint, and the fracture may occur in this area, may occur in this area, may occur in the intertrochanteric line, and may occur in the subtrochanteric plane. So the fracture and the fracture management are different in the different part of the hip joint and femur. Here we can see this is the neck of the femur fracture. This is another fracture of the neck of the femur. Here we can see the another fracture which is the partially displaced, and in case of number 4 it is the displaced fracture. Now the treatment option of intracapsular fracture. First of all, in elderly group, as the patient is elderly, so in elderly group there are two important sides. One is undisplaced or displaced. In our patient it is displaced, but the second option, that the mobile with one stick or better. Actually the patient is mobile, then not cognitively impaired. It is also true because our patient is healthy and medically fit for anesthetic and procedure. That means in this condition, all the three parameters are filled by this patient. So what we go for? We go for the total hip replacement. But if the patient is sick, unable to walk, or there is helping hand needed for work, he is medically unfit and cognitively not sound, in this condition we should go hemiarthroplasty. But our patient, as he is healthy, we can go for the total hip replacement. On the other hand, in case of the young group, when there is undisplaced and when there is displaced, when there is undisplaced there is internal fixation, whereas displaced a larger group can do internal fixation, and when there is severely displaced, some of the patient requires total hip replacement. So in younger group usually internal fixation, and younger group usually total hip replacement is if he or she is physically healthy, and hemiarthroplasty if the patient is not fit for surgery or ill. So what is our answer? Our answer is the total hip replacement. Why total hip replacement? Because 74 years old male, and also he live alone in the bungalow and enjoys playing golf. That means he is totally fit, and there is displaced intracapsular fracture. So the answer is the total hip replacement. In this patient, if she not physically well and cannot do her day-to-day life activity, in this condition the hemiarthroplasty would be the option. Dynamic hip screw and intramedullary nail, they are used in case of the intertrochanteric line fracture and subtrochanteric fracture. IM nail or intermedullary nail usually used in this subtrochanteric fracture.